right, everybody, we're back with our second Cabral house call of the weekend. Can't wait to dive in. I just opened up our community Ask Cabral Word document here. And of course, open it up to today. Today's episode 3061. My team does such a great job. I want to give them a shout out, as always, for doing a great job collecting the questions from Ask Cabral and putting them into one easy to read document for me. So if you want to read along with today's questions, head on over to stevencabral.com/3061. And of course, if you haven't already picked up your copy of The Rain Barrel Effect, please do so. It is free. You just pay shipping and handling. I pay for the printing of the book. All right. And then, of course, if you're international, head on over to stevencabral.com/shop. You can get a copy of The Rain Barrel Effect right over there. All right, let's dive right into the questions. As I said, today's episode 3061. And no medical advice, no medical treatment plans, no medical cures, no medical diagnosis, but hopefully something better, an actual underlying root cause as to what ails you to heal from the inside out. Let's get started. Jack's up first. Jack says, Dr. Cabral, you are the man, extremely intelligent and respected. It's an honor to ask. I have MCAS and high blood sugar, eat a very healthy diet, working out, plant-based, not a lot of fats. Pancreas is not producing insulin. Can you speak more about semaglutide on how it could help MCAS? Also, French lilac's main ingredient is metformin. I have tried berberine 500, 10 capsules a day, and it just doesn't work. Any suggestions for herbs, semaglutide, or metformin? Thank you. I feel stuck. I know the blood sugar is directly connected to the MCAS. Okay, so thank you, Jack. I appreciate the kind words. And yeah, I'm happy to help. So anybody who doesn't know what MCAS is, it stands for mast cell activation syndrome. I used to have MCAS, horrible MCAS, or mastocytosis, as they called it. And basically it's hives, it's allergies, it's histamine issues. It's awful. You feel tired, you feel inflamed. Your body's like a war zone inside all the time. It's not good. So here's how we fixed it. I had to fix high mercury. I had high mercury levels, and I also had terrible intestinal permeability, increased intestinal permeability, stemming from H. pylori, candida overgrowth, and SIBO. I had to fix all of those. I fixed them. I got rid of the heavy metals. I began to calm down my stress levels. I improved my sleep. And then over time, no more MCAS. So that's how I did it. It doesn't sound simple. It may not necessarily be simple, but it is straightforward. You're going to run the big 5 labs if possible. You're going to do the CBO protocol plus the citracidal. If you find something, you're going to then do the CBO finisher. At the same time, you can do the heavy metal protocol. You're going to start working on stress and lifestyle and sleep. And it's going to be very beneficial. In terms of the semaglutide or metformin, I can't give medical advice. Both of those can work very well for the body not producing proper levels of insulin. So it's a pick 'em. You might try one for 6 to 12 weeks. You might try another one for 6 to 12 weeks. They can both help, and they can both have their repercussions, but they can also both be very, very beneficial. If you need to lose weight, semaglutide is going to be the more preferred. It can have side effects. It happens to many people: nausea, constipation, gastric emptying issues. But metformin as well can cause muscle loss and other issues as well. So nothing's perfect. Hopefully, you won't need to be on these for the rest of your life. You'll use them for maybe 3 to 6 months. You'll begin to rebalance your body. You'll work with your doctor to begin to wean off. And that can be a great way to do it too. Again, like, I'm here to help. So people think I'm anti this, I'm anti that. I'm not. I'm here to help people with the least side effects possible and getting back to the body of a state of homeostasis. So thank you, Jack, for writing in. Appreciate you. All right, Justin's up next. What are your thoughts on stellate ganglion block as an alternative for prescription medication? So stellate ganglion block is not something that I have a lot of familiarity with. A procedure basically that blocks the nerves and blood supply, I'm assuming for overall pain in the body. Again, this is not something that I'm an expert in, so I don't want to talk out of turn. And I always tell you when I'm not an expert in something, and so I can't necessarily give you a yay or nay on this. In my opinion, what I can tell you is this. Obviously, this is most likely a pain-based issue, looking for prescription medication or this nerve block. I'm always looking at, if there's pain, there's inflammation. Is the inflammation from a biomechanical issue, meaning a vertebrae issue, so the vertebrae is out of alignment, impinging on a nerve, that can happen, right? There's a muscular issue, so a soft tissue issue, which these things can be fixed, right? By a good chiropractor that doesn't do just adjustments, they're also doing soft tissue work. It can be done by a good neuromuscular therapist, a good functional range conditioning specialist, a good postural based person. So a lot of people can help with this. And then if it is also inflammatory, like high omega-6s to omega-3s and heavy metals, you can also run the Big Five. And these are at stephencabral.com/shop. That's all of our labs are there. And then, of course, a good practitioner. But unfortunately, I'm not the expert on nerve blocks. And typically, it's a last resort, would be a recommendation of mine. All right, Jim's up next. Hi, Dr. Cabral. I hope you and your family are doing well. Same to you, Jim. I'd love your thoughts on a weird thing I've observed when using a PEMF mat in my Oura Ring. I've used 2 different PEMF mats, higher dose and the Therasage, at night, and I've noticed that my stress level on my Oura Ring goes up while sitting on it. I'm only using the heat function without PEMF. Why is this happening, and would it negatively affect my sleep? Thanks so much. So yes, heat is a stressor. Cold is a stressor. Fasting is a stressor. Working out is a stressor. So those are all going to, you're observing it based on what? Is it HRV levels? I'm assuming the stress level is going up, maybe showing your HRV dropping as well. All right, so that's totally normal. Totally normal. These are called hermetic stressors. They're small stressors that over time cause your body to become stronger, right? So that's literally it. 19 minutes of a sauna, right? Or an infrared sauna, a little bit longer, 30, 40 minutes. 3 minutes of a cold plunge, right? Makes the body stronger over time. So when we look at these things in the short term, yes, they are stressors. No doubt about that. It's a really good point that you brought up. And if it causes you too much stress, though, you may not want to do it right before bed. I found me doing sauna right before bed not ideal. So I actually won't let myself do it past about 5:30 p.m., which is about when I'm going to have dinner anyways. And so I don't do it after that. But some people are able to do it, right up before bed. I can actually do PEMF mat before bed, no issue at all, positive benefits, but not the heat, which is just more of a stressor for me. All right. Good question, Jim. All right, Mike's up next. Hi, Dr. Cabral. I've worked with you and your team members over the past 2 years on my journey to heal CREST. I'm grateful for everything that you do. Thank you, Mike. I appreciate you, and I'm glad that you're sticking with this and you're doing well. I'm doing a protocol built for me at the end of last year. I'm actually almost done with the CBO protocol and looking forward to my retesting. Although I generally feel great, I'm still suffering from CREST symptoms. Reason I'm writing in is because I'm curious if EMF exposure could be a primary cause of my symptoms. I've read that EMFs can cause calcification, which I suffer from badly. And when I think back to when my CREST symptoms started, it was around the time I started using a cell phone in my teenage years. Also, how can I limit my EMF exposure while WFH without disrupting Wi-Fi for work? Okay, got it. All right. So for those of you who are unfamiliar, CREST is the tightening or hardening or calcifying of the skin and essentially connective tissue. And so obviously this is something that we want to be able to help people with, and really looking for the underlying root causes, or at least imbalances in the body, is how we help people. We always do the Big Five. So stephencabral.com/Big Five or /shop. You always run the Big Five to look for all the heavy metals, the gut dysfunction, the omega-3 to the omega-6s, mineral deficiencies, vitamin deficiencies, food sensitivities, and so much more. So it's exactly what Mike is doing. Could Wi-Fi? Well, some people are more sensitive to Wi-Fi than others. Like, there's just no doubt about that. Some people are more sensitive than others. Some people are more sensitive to chemical sensitivities, to fragrances, to so much more. So I can't say exactly, Mike, what caused your specific symptoms, but I do want to say that I don't want to invalidate that there could be something to this. So what do? Well, we need to try to limit your exposure as much as possible. I don't know what your workspace looks like, but you can certainly limit your own Wi-Fi exposure with, I know it sounds strange, but putting up Faraday-based fabric, with having your own laptop blocker. So below your laptop, below your desk, there's laptop blocking pads. My cell phone, I keep it away from me, especially when I'm recording, but I have a cell phone blocking case on that. So always doing your best to basically block radiation. The way that you really do that is through copper strands or silver strands in fabric, and that helps to block that Wi-Fi. So that's the best thing that you can do for you. The other thing would be getting one of these Somavedic Again, the jury's still out on the power that it has behind it, but I like to say, hey, let's do everything we can. So the Somavedic device, you can see the one that I recommend at stephencabral.com/resources, and you keep that at your desk at work as well. So Mike, hopefully that was helpful. Wishing you all the best. Let's keep on keeping on. All right, one more question to go. It's from Andrea. Andrea says, hi, Dr. Ball. My husband gets a recurring stye. He is often put on a combination of oral pills called cephalexin and an ointment called erythromycin, which is, by the way, is an antibiotic for the eye. It gets better, then it randomly comes back several weeks later. Is there something else he can do to stop this? Please advise. Your content and advice have been life-changing for me. I'm so grateful. Thank you. Thank you, Andrea, for writing in. I appreciate you. So we talked about styes in the past. Go to stephencabral.com/podcast, type in conjunctivitis or type in stye, S-T-Y-E, and you'll see, what do I recommend? Colloidal silver, believe it or not, colloidal silver spray to the eye while also doing the viral-based protocol that's at stephencabral.com/760 and boosting the overall immune system. So do the daily foundation protocol, level 2, get in your omegas, get in your vitamins, get in your minerals, all the things that you need, right? But also use your vitamin D, use your balanced zinc, use your vitamin C every day. Boost the immune system naturally. So whatever virus keeps repeating itself inside of your husband's body, that we can start to knock that down. His Pro can be a really great product as well. 1 to 2 capsules, 3 times a day can be really, really powerful. Colloidal silver spray to the eye. Again, I can't give you medical advice, no medical treatment plans, no medical cures, no medical diagnosis. But anytime, that's what I used to do when I got a stye. Now, I will give you one more tip. I used to get styes while working inside of gyms. I would touch my fingers to my face. Tell your husband, fingers away from the eyes. No fingers touching the face anymore. If your eye gets itchy, inside of the shirt or some clean base cloth, close the eye, dab the eye, let the eyes blink to get out whatever's in it. Keep the hands away from the eyes. That's how styes are also passed as well. It's not the only way, because it can be internally viral based as well. But hopefully this is helpful. stephencabral.com/the-protocol. And for herpes and viral based issues, stephencabral.com/760 is my podcast on how to destroy these viruses and herpes. All right. Hopefully this was helpful. Thanks everybody. Appreciate you. Again, if the show is helpful, do feel free to share it with anyone else you believe could serve. I'll be back tomorrow on a brand new Cabral concept. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything. Functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.